Greetings. My name is Dr. Sean Convoy. I am a psychiatric mental health nurse practitioner and a member of Duke University School of Nursing's faculty. I wanted to take a few moments of your time to offer some guidance as it relates to the potential psychological impact associated with COVID-19. To be clear, I think it's important to distinguish between grief and loss and post-traumatic stress disorder. To varying degrees, we will all be experiencing grief and loss in relation to this event for some time to come. In each one of our lives, there are dark events that chronicle the passage of time. Pearl Harbor, the Kennedy assassination, the Challenger explosion, September 11th. Well, we now have a new event, COVID-19. And while this event is unquestionably a trauma, I want to reinforce that the vast majority of the population will navigate this loss, like the others, without incurring a chronic mental illness. 12-month prevalence rates for post-traumatic stress disorder are 3.6%, and lifetime prevalence rates for the same condition are about 6.8%. In the final analysis, concerns about the potential impact of COVID-19 on mental health is most certainly worthy our time and attention. However, it is not necessarily worth our perseverated worry. Right now, we have an amazing healthcare delivery system that's marshaling all of its resolve to run a sprint to address the acute healthcare needs of those infected by COVID. Those of us who are in the mental health field are standing by ready to deliver psychological first aid, crisis intervention, and augmented social support during the sprint. But in many regards, our work will begin after the immediate crisis subsides. In that regard, we will be running a marathon, and we're going to be ready. Now, for those who will manifest post-traumatic stress disorder, it's important to note that PTSD is not necessarily a chronic condition. While some may very well develop clinically significant symptoms of traumatic stress in relation to this event, I would argue that the vast majority of those affected by it will encounter symptoms that largely have a beginning, middle, and end. How long the symptoms last is significantly influenced by what that person does or doesn't do to address the symptoms and associated functional impairment. Those individuals who are likely most vulnerable to chronic forms of traumatic stress are those who have already been exposed to a traumatic stress in the past, those who struggle with meeting their basic needs, and those who have already had a diagnosable mental illness. Now, those who fall into those three categories are encouraged to plug into mental health care early if they're experiencing functionally impairing symptoms. Now, when it comes to self-care, I recommend the following. 1. Ensure you do your very best to stabilize your sleep. 2. Don't use the crisis as an excuse to stray from healthy lifestyle choices. 3. Resist the urge to use alcohol or other substances as a stress management tool. 4. Be mindful of how you spend your time and who you spend it with. Toxic people and situations are more toxic during periods of crisis. 5. Limit your exposure to social media and the 24-hour news cycle. If you find the combination of the audio-visual medium too evoking, read or listen to the news and avoid video. 6. Be mindful of the things that you say to yourself about yourself. Give yourself the same kind of grace you offer others. So often during crisis situations, we tend to focus on that which we can't control and neglect that which we can actually influence. For example, we can't personally control the national and regional infection rate, but we can control our behavior and how that contributes to the infection rate. We can't personally control the frenzy on social media and the 24-hour news cycle, but we can control how much of that we consume on a daily basis. And we can't personally control what people around us say and how they treat us, but we can control what we say to ourselves, about ourselves, each and every day. My friends, the human species has a 100% survival rate for these situations. This time in our history has a beginning and a middle and an end. We can't control all that happens, but we can control how we respond to what happens. One strategy I use in situations like this is to get out of my head, and the best way to do that is in service to others. Please, take care of yourselves. Be well.